All right, good morning, everyone, and welcome to the Integrity Connect training on quoting and submitting Medicare Advantage and PDP applications. My name is Melissa Rabas, and I am the manager of the new business department here at Premier. I want to thank you all for taking time out of your busy schedules to learn more about how our Integrity Connect system can help you save time and sell more. Please feel free to type your questions in the Q&A box, and I will try to address those as we go along. We've got a lot to cover today. We want to go over how to send a scope from Integrity Connect, how to run a quote, the ways to filter a quote, checking plan details, sending plan comparisons to your client, and then finally submitting that application and completing the HRA. So let's get started here. All right, so the first thing that we want to do is we want to send that scope of appointment out. So I've created a dummy account, very original, I know. You'll go over here to the Connect tab, and then over here on SOAs, you can hit New SOA. You can also do it by, you don't have to go into this Connect button if you don't want. You can hit the contact from up at top and just hit scope of appointment, and it'll take you right to the screen. So multiple ways to get there. If you want to send a new scope of appointment, you would hit this new SOA button, and it's going to give you two options. You can either send a digital scope of appointment for your client to sign, or if you have a paper scope that your client has already signed and you just want to upload that or attach it to your client's profile, you can do that as well. So we're going to go over how to send a digital scope. So you can send it to their email or a phone number that is set up for texting. The system will default to whatever contact information you have in the system. So mine has an email address tied to it. So we're going to go ahead and use that. If maybe they needed it sent to someone else's email, a spouse's email, or they want it sent to their phone, you can always hit new email or new phone, change that option, and enter that information in there. This 48-hour scope of appointment rule, I know it's going away for 2027, but for now, you do have the option to track that 48-hour waiting period. If this box here is checked, you will not be able to sign that scope until it's been at least 48 hours from when the client signed it. If you want to be able to complete that scope as soon as you get it back from the client, uncheck that track 48-hour waiting period button. You also have the option to send the scope in Spanish if that is your client's preferred language. And then you just hit send SOA, and it will pop up a little button saying, hey, I sent that scope of appointment. And also you'll see here in your activities, give it a minute. Okay, so in Connect, you can see that the scope has been sent, and then it will also populate a note in the overview. All right, I am going to see if that by chance it did come through. Okay, so this is what it's going to look like. It'll have some pictures and stuff here. My email just blocks all that kind of stuff. So it's going to say, hey, dear client, your agent has sent you a scope of appointment to sign, and then it'll prompt you to complete that scope of appointment. When you click on that complete scope of appointment, it takes you out to that agent's to your plan enroll website. The client will be able to select what plans they want to discuss. It defaults to all of the plans, but if they know they don't want to talk about MedSup, they can uncheck that if they wish. Whatever information you have entered under that client's profile is going to pre-populate in the scope, so that is just less information for them to have to fill out or for you to have to fill out. If you have an authorized rep who's going to sign the scope, you would, of course, hit yes here. Otherwise, they can just skip that button and come right down here by checking this box. I've read and understand the contents, and then they hit submit. And it just says, hey, thanks for submitting that scope of appointment. Now, if we come back over here, we're going to go ahead and just refresh a little bit. And you can see that the scope was sent at 10:04 and it was signed at 10:06, and it's now giving you the option to complete that scope. You would just scroll down, make sure that you've got all of your information in there. This is the kicker. It asks this little question here, the initial method of contact. So I'm just going to say walk in. And then was it signed at the time of the appointment? I'm just going to hit no. And then by checking this box, I confirm the information is true and accurate, and then hit submit. If you aren't getting this blue submit button to highlight, it's most likely that this initial method of contact wasn't filled in. And it doesn't matter what you type in there, but I have missed that many times myself when completing that scope. So, all right, submit. And now you've got that confirmation number that the scope was signed, and you will now have a signed scope of appointment tied to that customer. And if you need to view that scope or print it at any time, you can always hit view. And if you want to download it, you can click this button or you can print it. They've got print-friendly versions now, so hopefully that will make your life a little easier. I did mention this before. You can also upload a scope of appointment if you have a paper app, or excuse me, a paper scope. You just click on Upload SOA. You'd drag and drop or open your file here. Let me see. SOA. This is using our AI processing, our smart docs, and it's going to read that scope of appointment, and it's going to, there we go. And it's going to say, okay, I'm recognizing this as a scope of appointment. So I'm going to upload. Okay, and it's going to read that document and it's going to say, hey, some of the information doesn't match up. Do you want me to correct this information in the system, or do you want to stick with what you've got in the system? So you can see on the fake scope that I just uploaded, it read it as John Smith. I can either say, no, I want to keep Melissa Johnson, or I can say, yeah, go ahead and update the middle initial to L. And it will say, oh, yeah, it looks like they wanted to talk about these two products. You can either upload and update, and it will keep whatever is highlighted in blue, or you can upload and skip that update. Okay, Kathleen, what email does the client see that the scope is from? Okay, so it is going to show no reply at planenroll.com. Okay, perfect, Carol. All right. So that is the scope of appointment, sending that. One thing I do want to mention is that before you start any applications or quotes or anything, it's always a good idea to make sure that you've got your client profile updated. The more you've got in your client profile, the less you have to enter later. All right. So on the left-hand side, you'll see the name, the date of birth, email, all of that good stuff. If you need to change any of that, you can always hit edit and change that. You'll also want to double check the information in the medical profile. You want to make sure that the doctors, the prescriptions, the pharmacies, all of that are set. So that way, when you go to run your quote, it gives you the most accurate information for your client. I preloaded all of this. So just sorry, to help save time for today. So I want to mention a couple things. So from here, we can start that quote. Starting hopefully next week, we are, Carol, will it tell us whether the doctor accepts the plan? It will show you if that doctor is in network. So if they are in network, then yes. Okay, so excuse me, got a tickle. So there is a new feature that is coming out, and we're very excited to announce it to you guys. We're thinking it's going to launch over the weekend, but I can't promise. So sometimes they have to tweak the final little details before they can launch a new feature. But we are excited to announce that we are going to offer the ability to check the client's benefits. So it is information verified by CMS. It will show you their current Medicare plan. It'll verify their address, their Medicare A and B dates. You can also do a Medicaid eligibility and level check if you wish, and the LIS copayment level. So some really exciting features coming up here. I can't, excuse me, I apologize. So I can't go into great details or give you a great demo because it's not live yet and because we can't do a demo without live client information. And of course, that would be a big HIPAA violation. So we're just going to, I'll give you some slides here to kind of give you a general idea of how it's going to look. So you can either check the eligibility through this quick quote button up in the top right corner, or you can do it in your client's profile. So this screenshot here is from the quick quote screen. You would just click the run eligibility check. And then you'll enter in their name, their first and last name, their date of birth, and their Medicare number. And then you'd hit run eligibility check. Of course, if you're doing this from the client screen, it's already going to have all that information populated, so you won't have to enter all of that. So when, excuse me. So when you run that eligibility check, if the system finds that the client does have Medicaid, it's going to pop up this box saying, hey, the eligibility check has determined that the client is Medicaid eligible. If you want to know what their Medicaid level is, you need to enter their Medicaid ID. This is totally optional. You do not have to enter their Medicaid ID if you don't want. You can always hit the skip button. But if you want that Medicaid level, you do have to enter the Medicaid ID. It does not work to put their Social Security number in here. It has to be their Medicaid ID. So this is just a quick screenshot of what the information is going to look like. This is all fake information, of course, but you can see that up at the top, it has their name, their current Medicare plan. It's got the plan name, the plan ID, the enrollment and disenrollment dates if disenrollment applies. It's going to validate the client's address. And again, it's going to give you the option. So if you want to update any information in your client's profile, like maybe you had 123 North Buchanan and it came back 123 North Buchanan Avenue, you can choose to update that. You would just click on this one to select that you want to save those changes. And then down below, you would hit save changes. Okay, and the next screen, this is where it's going to show you that Medicare and Medicaid information. So it's going to show you that, yes, they are Medicare eligible. Here's their Part A date, Part B date. It's going to show you if they're Medicaid eligible. On this left-hand side, that's going to be what you entered into the system. So the right-hand side is going to show you what the eligibility verification came back with. And then it's going to also show you if they are eligible for LIS. The LIS eligibility will populate whether or not you put that Medicaid number in. So, um, Carol, these are in quick quote. And then there's also an option under the client's profile to run this check as well. So, and again, this has not launched yet. They are hoping to launch it over the weekend, but wanted to kind of give you guys a quick preview so that way you know what to expect. And if you see something different coming up next week, then you know what is going on. Okay. Okay, Dennis, there are one or two carriers that will not show whether or not the doctors are covered by the plan and integrity. It's a carrier preference, and sometimes it's just a matter of timing where the carrier hasn't given us an updated feed, and sometimes it's carrier choice that they want people to go to their website. It's always a good idea to just verify on the carrier's website that doctor is indeed in network. It's always a good practice. Um, because, like you said, sometimes they haven't gotten us an updated feed if something changes or if, maybe they added one of the locations that the provider's in and took away another. So always a good idea to double check the carrier's website. All right. So we talked about doing the quote. You would just hit start quote. Okay. It is going to default to MAPD unless you have it defaulted. Let me see here. If you say yes to Medicaid down here under the client's profile, then it will default to the DSNP plans. Otherwise, if you have no selected, it's going to default to MAPD. All right, so you can see, we have a lot of filters on the right-hand side. You can change the effective date. You can, if they have more than one pharmacy listed, you can say, hey, I want my drug estimates based off of this particular pharmacy. If you do not want to show non-commissionable plans, you can toggle that off. If you want it to show PDP plans or MA only plans, you can use those toggles. If you know your client is absolutely certain that they want a particular benefit, you can select those core benefits. If you want to select or filter it out by certain star ratings, you can do that. If you know you only want a PPO or you only want HMOs, you can do that. It is going to default to show my appointed plans. Those are the plans that you are appointed or certified and appointed, ready to sell, and that are available for enrollment on the platform. We know how many plans the carriers have suppressed this year. So depending on that carrier's level of suppression, that plan may or may not be available for enrollment. So if you know that there's a plan available in your area and you're not seeing it, first thing I would do is uncheck my appointed plans and see if it shows up there. If it does, and you know that you are ready to sell for that carrier, then I would say it's most likely a suppressed plan, and that's why it's not showing up. Otherwise, you can also uncheck the My Appointed Plans if you want to give your client a comparison of other plans that are available in their area, but maybe you're not actually ready to sell with that carrier yet. So you can do that. If you want to say, hey, look, there are these other plans, but this one is the one that's best for you, that's always an option as well. I'm going to go ahead and turn back on My Appointed Plans. If you want to filter out just DSNP or CSNP or iSNP plans, you can do that by selecting one of those toggles. Uh, and then, of course, this particular test account only has permissions for UHC, but if we uncheck the My Appointed Plans, all the different carriers would show up and you'd be able to filter by carrier as well. Okay. Got a couple questions here. Carol, Carol, let's chat after the webinar and see if we can get your contracts to show up for you. So we'll chat after the webinar on that. And can we quote 30-day supply instead of 90-day? Absolutely. So you can either go back and change that in your the client's medical profile, or you can say, we're looking at this plan here. You can click here where it says the prescriptions that are covered, and you can edit, like say this one, oh shoot, the capsules aren't covered. Let's go back and let's choose the tablets. Delete it. There we go. Add it. We're going to add the tablets. And you can change your quantity right here. So if you know your client gets 90 per month, or if they get 90 per 3 months, whatever, yes, you can adjust those quantities and the frequency right there. And then it will run those calculations again. Okay, so you can view all of the plan information on this screen. You would just check this plan details button. And it's, there we go. It will show the plan premium, their estimated drug costs, the cost by month, what prescriptions are covered, what those costs would be, the providers, the pharmacies. It's going to show you all of those plan details. And if you scroll all the way down to the bottom, it will give you all the different plan documents as well. So if you've got something that you want to bring up for the client, you can always do that as well. Now, if you want to send your client a comparison, you can select this little, it's a tiny box, but there's a little box next to compare. You can compare up to 3 plans. And I don't know if you notice this here, but it's an option to select their current plan. So if you've got that client in your system and you've already got their current plan information in the system, you can hit that select current button and it will compare the proposed plan to what their current plan benefits are. So that's a feature that just launched within the last couple months. So that is, I think, going to be very helpful, especially during AEP. So that is an option out there as well. And then you just hit that comparison button, and it's going to show you the different plans, you know, what the cost per month is, all of the different information that we just looked at, what providers are in network, prescriptions, so on and so forth. You can either print this for your client if they're sitting right there with you, or you can hit share. You can email it or text it to them. You can also send it in Spanish, and you would just hit share, and then it's going to email that over to your client. Let's see if I can get a preview of what it would look like when it's printed here. Okay. I'm waiting for that to load here. You can see the client got an email here where it's again from that no reply at plan enroll email address. And it's going to say, hey, dear client, here's the plan details that we discussed. So they would hit that view plan, and then there's also a code that they need to copy and paste to actually open those plan docs. Again, it takes you to, or they will take the client to your Plan Enroll website. They'll enter that code. And then they can see that plan comparison for themselves. If they want to take some time and really read through things, look at all of the different plan details. A lot of times, you'll know best whether they are actually going to look through that or if you can just go on to the enrollment. But if you want, your client can also self-enroll from this website. You just want to make sure that they see your information at the top of the page. It does happen, it's not common, but it does happen where if the client was in your Plan Enroll website, maybe they were logged in and then logged out or got timed out, it takes them to the national Plan Enroll website. And then if they open up that link, sometimes it will default back to that national site. So make sure that when they view that information, that they see your name and your contact information at the top of the page. That will ensure that they are on your site and that you get credit, I guess, for that application. So, all right. And it did pop up that print friendly version. And again, it will have your contact information at the top of the page. So that way they can see your information as they are going through the plan docs. Okay. So if you know that your client wants to apply for one of these plans, you can hit apply from this screen, or you can go back and apply from the other screen. I'm just going to hit apply right there. You do not have to download this checklist if you don't want to, but you certainly can. It's going to pop up a screen saying, okay, how is your client going to sign the application? Are you going to send it to them for an e-signature? Are you doing a face-to-face appointment? Or does your client want to do a voice signature? So those are your two options. I'm going to just select send to beneficiary for e-signature. And if we have time, I'll go back and do it with the face-to-face so you can see the differences there. Okay, so it is going to take all of the contact information that you have in your client profile and fill it out on this application. So if there's anything you want to add, like if you want to add their middle initial, or if they want to use a different phone number, you can always change that here. Same with the physical address. If you know they have a mailing address that they want to use, you can hit yes and add that mailing address. If they want to provide an emergency contact, they can do that. All right, and then it's going to take us to the Medicare eligibility information, and it's going to ask you for the name as it appears on your Medicare card. For some reason, that name does not populate, but otherwise, and it's not a required field, so if you don't fill it in, it's not the end of the world. Medicare number is going to pre-populate. It is required to enter a Medicare number. It will not let you put pending in there. A and B dates are optional. What is their requested effective date? And then here's where you would choose their election period. One quick tip, and I don't know why it's here, but if they are in their initial enrollment period or their IEP, that election code is under the heading of you have a chance to get other coverage. I think it's a goofy location for it, but they didn't ask me. So But otherwise, all of the SEPs are here. And if there are any uh, carrier nuances, you'll see those here. But otherwise, all of those election codes are here. We're just going to go ahead and do IEP. And then it's got the generic questions that are asked on all the applications. Are you going to have other drug coverage? And then, of course, you can see these questions are not required because they do not have an asterisk. If they want their materials in a different language, you can select that here. If you want to put in their physician information, or if it's an an HMO and they need to put in their physician information, I suggest, let's see here, you go back. You can either type in their name, but I think it's easier if, just saw it yesterday. You go back to their profile, to the medical information. You hit edit there. Their physician number or their doctor number is right there. So it's easy to just copy and paste that. Otherwise, you can hit those find a physician buttons and it will take you out to the carrier's website where you can locate that physician information. Okay, then it's going to take you to the screen where it talks about paying for their bill. It is not required for this particular plan. I'm going to go ahead and select they're going to get a monthly bill. If they want deduction from their Social Security check, you can do that as well and just select which kind they have. And then here's, of course, all of the required disclosures and everything. You check the box next to I understand. And then it's going to ask you what is your relationship to the person enrolling in this plan. So if the client is sitting right there with you, you would use the I am the person enrolling. Otherwise, you would select I am the person, I am helping the person enrolling. Or if you've got, like say a POA, you would hit I am the authorized rep and it would pop up the information for you to fill out for that authorized rep. All right, I'm going to go back and hit I'm the person, helping the person enrolling. It'll pop up your information there and then hit continue. And this is your opportunity to review all of the information that was entered and make any changes that are needed at that time. I'm comfortable that we entered all of the information correct. So I'm just going to scroll all the way down to the bottom and hit send to beneficiary. And it's going to say, okay, do you want to email it or do you want to text it? I'm going to go ahead and email. And do you want to include any of these documents? So if you want to include, like, say, the summary of benefits or the EOC, you can do that. I'm going to uncheck the Spanish and I'm going to uncheck the enrollment application. The enrollment app is not the actual document that you've just filled out. It's a blank copy of an application form. So we're going to go ahead and hit send application. And it's going to tell you it was sent to this email address and here is the code. The client will also get an email with that code, but it doesn't hurt to jot it down just in case the client didn't see that second email come through or if there's an issue. So, okay, so you can see here is sender. All right, so here is the code that they will get, that they will need to copy. And there will be another email coming here. There it is. Where they can go in and see there are all those documents that you just attached. They'd hit view application. And again, it's going to open up in the Plan Enroll website. Actually, I spoke too soon. It is not open in Plan Enroll. Okay, so here it's going to have them review that information statement and verify that yes, that is all correct right there. They'll hit continue. They'll be able to review all of the information that you entered. So if they come back and say, "Oh, nope, my phone number should be 8909 instead of 8908," they can contact you, have you correct it, and actually they can edit it right here. So if they wanted to fix it right there, continue. And it's going to take them back and say, "Okay, yep, let's go back and review all the information again." It's going to take them through all the sections of the application here, and then review. Okay. So once they've reviewed everything and they agree that it's all correct and they are ready to apply, they would just hit that submit button. I'm not going to hit submit because we don't actually want to submit that application, but I do have a screenshot of what the confirmation email looks like. This will show you, it'll give you the member's name, their address, when it was submitted, and that confirmation number. And then it would also pop up the option to complete the HRA at that time. So any apps that you have submitted will display an activities section of the client's profile. Since this was a test system and we didn't actually submit the app, I can't show you live, but there's a screenshot of what it will look like. If you, back here, if you click on this link right here, it will take you to this screen where you can view a copy of the application. If you want to add a note to the activity, you certainly can. I don't know what the note would be, but it does give you the option. You can also open the application. So anything is all right there. And then also with that activity section right there, you can, if you hit the view there, it will take you to the policies benefits. Actually, it's not from that screen. It's from the products section of the client's profile. You'll see this pending policies or current policies section. It will give you the option to view policy. And if you do that, it will bring up basically that plan information guide where it's going to show you all of the providers, their network status, the costs, the prescriptions, what they were expected to cover, that kind of thing. So that is all right there as well. Okay, I see we've got a few questions here. Kathleen, does the client receive two emails? Yes, one with the code and one with the application to sign. You are correct. Carol, do they have to do this or can we just hit submit ourselves? The client, it depends on what signature option you choose. If you choose send a beneficiary, then the client has to do it. Otherwise, if you do the face-to-face option, then you would be the one that would hit submit. Earl, do you need to read the disclosure to them if you were emailing it to them? I am not 100% sure what the guidance is on that or what the rule is on that. I think for best practice, I would, especially if you're recording the call. I think I would read it all that way. You got it in recorded that you read them all of the disclosures and they agreed they were well aware of everything. Okay, and if you do it face to face, does the client sign on the screen? So we've got some time. I'm going to go ahead and close that out. I'm going to go back here and we're going to do another one and we're going to choose that face to face option. That way you can see what it looks like. Do face to face. And the experience is going to be the same no matter what carrier you choose. I'm doing United Healthcare because that's the selling permission that's loaded in here. The experience is going to same. It's going to have the same flow, most of the same questions, no matter what carrier you're doing. Some carriers will have a couple extra questions, um, but they'll integrate those. But again, the overall flow, the overall experience is going to be the same. Okay. So again, it's going to pre-populate all of that information. Continue. It started this one last night, just so we could kind of go through it pretty quick. Okay, so then it's going to have you review everything here. Now here, you can continue to voice signature if you wish, or you can hit submit. I don't remember which carrier it is, if it's Aetna or Humana or one of the others, but before it even takes you to the application, it pops up a screen with like a dozen different disclosures or dozen different statements that you have to read to your client, and you have to check mark each one of them as you read them to the client or the client reads them. United Healthcare obviously doesn't have that, but just wanted to mention that that is something that pops up on some carriers. All right. Um, okay. I'm just trying to see if I have anything here. Okay. All right. So you can either hit submit and you will submit the application, or you can continue to voice signature. If they're going to do voice signature, of course, you have to read each statement to the client. And then when you get to this part, say if you agree to complete your enrollment now, please state your name, your date of birth, and that you agree. You would state all that information and then you'd continue reading and then you hit continue applying. And you can see that it's got that signature recorded and then you hit submit. Eduardo, if we talked on the phone and I email a plan comparison and they self-enrolled, when do we do the presentation? So the presentation, it'd be something that you would do before you actually sent them the information or the link to enroll. Okay, I know we went through some of that kind of fast. Um, do want to mention with the HRAs that some carriers will have you do it right through Integrity Connect, and then other carriers will take you out to their website. So if it takes you to a different website to complete it, don't panic. That is by design. I know, I believe it's Humana is one that does take you out to their own website to complete that HRA. Let's see. It should carry over all of the client's information to that HRA, if it's done through Integrity Connect, and then you just have to go through the questions and click Continue Assessment. Okay, Jenny, if your appointment is a kitchen table appointment, do you have to send or bring the scope 48 hours before the appointment date? I would actually get with your marketer on the particular rules around that 48-hour. I know there are certain times of the month or certain circumstances where that 48 hours doesn't apply, but I don't know all of the ins and outs of that. So I would get with your marketer and talk through that. I Just don't want to steer you wrong or give you wrong information here. Carol, is it possible to upload all of my existing clients? Yes, you certainly can. Back here, since we've got a little time, there is an import button up here in the top right corner where you can drag and drop a CSV file that has your client information in it. And then you can actually import the clients that way. There is a template up here that works fabulous. So if you open that up, right over here, you can see what fields are available for import and what format they need to be in. So like if you can import the phone number, but it has to be full 10 digits. It can't just be, it can't have the one in front and it can't, you know, be just the last 7 digits. Like the city is optional. Birth date has to be in this particular format, so on and so forth. So if you put it in this template, it actually does import a lot smoother. All right. The import is back on the Clients tab. It's right below this dark blue bar. It says Import. And if you've got any issues when you're doing the import, reach out. We'd be glad to help walk you through that process. That's no problem at all. Okay, feel free to keep those questions coming. I do want to mention, though, that Integrity has a great website with webinar recordings, list of upcoming webinars. Let me just go ahead and pull that up. So they've got upcoming webinars talking about the permission to contact feature that is coming. And they've got, you look at the health tech, all their recordings. So they go into a little bit deeper dive on how to verify the Medicaid and Medicare eligibility, the document management feature, all of this. They've got so many more. You just hit view more, you can see all of their webinars. They do a fabulous job, way better than I do at going over all of these different features and all of the options that are available in Integrity Connect. So if you do have a question, I encourage you, if you've got the time, to go in and watch some of these webinars. They're great. They also have what they call Tech Tip Tuesdays, where it's a quick, like 10 to 20-minute presentation on one particular feature, and they go over some different questions. So I do encourage you to check those out as well. Okay. All right. How do they reach me for help? Great question. Just wanted to plug, we do have a couple upcoming webinars coming up. July 23rd, we're going to talk about submitting med sub apps. And then in August, we're going to go over some of those lesser known features. Here is how you contact Premier. So we do have a dedicated team to help support you with the platform. That is the 402 number. You can also email us at platformsupport@premiersmi.com. You can always reach us at the 800 number too. And that's also a good number to call your marketer at. And then Integrity does have a live chat feature. And I can show you where to get to that. It's available on any screen that you're on. It's just this Integrity eye symbol here. Actually, I told you wrong. It's the question mark. There we go. And it's going to say, okay, what platform or what basic information are you needing help with? Do you want to check out our FAQs? I'm going to say Integrity Connect. It's going to prompt you for your FMO and for your NPN. And then it will say, hey, if your FMO is Premier, here's their contact information if you want to reach out directly to them. Otherwise, you can certainly continue the chat. You don't have to go to your FMO if you don't want. You can continue the chat. So that is an option as well. Okay. Earl, you have a lot of current customers, but they're showing as unlinked. That typically happens when we get carrier feeds. If something doesn't match up exactly with the customers that you already have built in the system, it's going to show up as an unlinked policy or unlinked customer. There's no easy way to link those other than going through them one at a time. Otherwise, they should come through as linked, again, if the information all matches. Now, if you've got the customer in your system as Beth, but their enrollment came through as Elizabeth, it's probably not going to link up. So that's one of those reasons why sometimes they show up as unlinked. So unfortunately, there's no quick and easy way to link those, but there is, it can be done. It's just there's no quick and easy way to do it. Is there a link to sign up for the Integrity website? Jenny, yes, you certainly can. All you have to do is type in integrity.com, hit your login button, and it's because I'm already logged in, it's going to prompt me. It's going to take me directly in. I'm going to go ahead and sign out. Okay, this is the screen you should see. Down here at the bottom where it says don't have an account, sign up. Click there. You would put in your national producer number, your name, email address, phone number, and password, and hit submit. That's all it takes to sign up for the Integrity website. But again, these webinars and everything are free. You do not have to have a registration to go in and, or you don't have to have an account to go in and view these. If you do want to watch one, I think it prompts you for your name and NPN. It's just that simple. All right. I know we went through a lot of things and we went through kind of fast. Again, if you do have any questions or if you need any assistance after the webinar, Carol, let's talk about your contracts. You can always, like I said, give us a call, shoot us an email, and we'd be glad to help you with that. Can you delete a client? Yes, you can. So in your client profile, if I wanted to delete my record out of here, you just check the little box right next to the name, come up here, hit delete, and it's going to say, are you sure? And you just hit delete. I'm going to cancel out because I don't want to delete that one. But you can also manually add a new client if you wish. And if you want to just run a quote, you don't want to have to enter all the client's information, and it's going to want me to sign in again. You can hit that quick quote button. So you can hit that quick quote button. When it launches, that verify eligibility button will be right down here in the bottom. Okay, so here's an example. This agent's selling permission or this test site does not have anything in Nebraska. But if I wanted to see the plans that are available in that zip code anyway, you just uncheck the My Appointed Plans, and then you can see those plans. Earl, this webinar should be sent out to you within the next few days, so you'll be able to view it that way. And again, if you do have any additional questions, you can always go to the events.integrity.com website and view their webinars. And there is also a learning tab within Integrity Connect that has lots of great information. They've got a link right out to those webinars. So you can do that. If you can't remember the website, which I understand there's a lot of websites to remember, so you can always access the webinars that way. You can see all of the recent webinars, the upcoming webinars, Tech Tip Tuesdays. If you want help setting up your account, we've got tons of help topics, learning topics right there. You can scroll through them, you can search. And I do want to plug this as well. With the craziness of AHIP and all the certs and everything, if you need information on your carriers, like, okay, when do their certs launch? Where do I go to complete them? You can always click on that carrier. And if we've got that information, we've got it out here for you. So you can see, like Aetna, we've got their 2027 instructions for certifications. We've got a link to the site where you need to go. All of that different information is available. So that's always a good resource as well. All right, I will hang out here for a couple more minutes if anybody's got some questions. Otherwise, I want to thank you all very much for your time, your attention, for all the great questions. And I encourage you again to reach out to us if you have any questions at all. We are definitely here to support you. We want to make things easier for you. The technology is not designed to make life tougher. It's designed to make things easier, to help you save time and sell more. So if there's anything that we can help answer for you, please do give us a call or shoot us an email, and we'd be glad to help you out. So thank you again, and I look forward to seeing you soon. Jenny, thank you. I appreciate the comment. And yeah, we would definitely want you guys to be successful. So we appreciate your time and your attention. If you've got questions that come up, 3 hours from now or 3 days from now, shoot us an email, give us a call. We'll be glad to help you out as well. Like I said, I know I went through things kind of quickly, so a good tech or a good tip, I guess, is always to just create a dummy account in your profile or in your platform and do test. Put yourself or your spouse or family friend, whatever, your dog in there. Um, Practice sending the scope, practice doing some applications, just don't hit the submit. And that way you kind of get a feel for the flow and how everything works before you get to that client. So just a little tip. That's how I learned. A lot about this, I guess. So, all right. Thanks, everyone. And I look forward to talking to you soon.